a lot happening here. You're offering your sites up as vaccination sites, as well as flagging them on Google Maps and on Google Search. Talk to us about why you think this is how Google can have the biggest impact.
Well, Emily, thanks for the time today. You know, Google has been leaning in to be supportive of public health authorities since the beginning of this pandemic. People come to us by the millions every day and want information about health, but particularly in this pandemic, they've wanted to know how to protect themselves and their families. So in a number of ways, for the last year, we've been raising up information from health authorities like the CDC. And this work for the vaccination effort is just another turn of the crank. It's another cycle of us putting forward good information for the community when they come looking for it on search or maps or YouTube. And it's a way that we want to help facilitate everybody getting vaccinated, because as the community goes, we all go. So the announcement that we made today, for example, is a way that we can provide resources to public health authorities, to local community-based organizations who are often the most trusted on the front line by those communities, to see that they can get the information that they need about whether they're eligible for a vaccine, to address hesitancy, to build confidence. And then when the time is right for their turn, they'll know where to go to get vaccinated. So what we'll put on Geo, Emily, is going to be the availability of vaccination sites in all across communities, not just those that Google's willing to make available, but of course, any local facility that's going to be able to vaccinate people in the US and eventually worldwide.
So let's talk about the $150 million you are putting behind to help what you hope will be faster distribution of the vaccine, more equitable distribution of the vaccine. How can you make sure that the money will in fact do that?
Well, Emily, one of the things that we know we have a responsibility in is around good information in general, but especially around vaccines and vaccinations. And one of the important ways to get people to understand from the demand side whether they're eligible, answer their questions about vaccine safety, understand how vaccines are made, what is the scientific and regulatory pathway that's normal. We want to help those agencies that is their job on the front line. I'm a former public health official in New Orleans, and I know that it's really important that our message gets out to community, and that community is going to look to trust the local pastor or the local community health worker or community health center. So some of the resources that we're providing will be to help amplify the messages and the information that those local communities want to share with those trusted community members that they have. So that's one part of it. We're also working on some important equity work. We've already been partnered with the Satcher Institute at Morehouse to bring forward information to help us understand as a world, especially as a country, how we're doing in terms of equity. Are we making sure that the vaccines are going to reach the right populations who are at higher risk? And so partnering with them is a way to bring data and information to give insights to public health to know how to target vaccination campaigns. I think the last piece that I would call out is just this opportunity to make sure that local frontline organizations who are the last mile, they're really the place that community members are going to turn to know that they can get vaccinated and to answer those questions. So while we'll put information on search and Geo and YouTube, I also know that, you know, as a doctor, sometimes those questions that get asked of me right in the exam room, I need to be prepared to point people in a direction when they're in that moment of decision making. And that's and sort of another bit of way that we want to be helpful to the world to see that everybody can get vaccinated when it's their turn.
Now, as a doctor, we hear President Biden saying he can deliver 100 million doses in his first 100 days. We're seeing these models that say the U.S. will be fully vaccinated by June or July. Does that all sound realistic to you? When do you think this country will be fully vaccinated?
Well, Emily, this is no doubt one of the most challenging things that our world will ever try to do. In the history of mankind, we're trying to reach everybody on the planet with a vaccine. And it's not just one vaccine. I think because of the remarkable feats of science, we have a number of candidates that are either already available in the field and some that are in the pipeline. So I raise that just to say that I want people to remember that there are a number of vaccine candidates that can be made available for vaccination, but it's the vaccination part that saves lives. It's getting people on the front line to have that shot in the arm. And that work requires logistics and making sure that the supply chain works well, that we have enough medical glass and the right kinds of syringes. And it also means that there has to be uptake. People have to be ready to receive. They have to have confidence in the scientific and regulatory process. Where they have hesitancy or questions, they have to have trusted places they can go for information. For some people, that's going to be CDC. For others, as I've said, it's going to be their local doctor or the local pastor or community health worker. So it's a complex operation we're trying to all undertake, and that's why Google wants to do our part. I mean, to me, this is going to be an opportunity for everybody to lean in the public and private sector to put forward what they can, whether it's facilities, information, or resources, so that we can get everybody vaccinated in a timely fashion.
Now, we don't have much time left, but this is a really important question. How do you feel as a doctor? How satisfied are you with the efforts that Google has made so far to combat misinformation and vaccine misinformation, not just on Google itself, but also YouTube?
I joined Google a year ago, and my background in medicine and public health was an amazing opportunity to marry up with the technologist here. What I didn't realize was the millions of people that come to us for information every day, and we take that as a serious responsibility. Not only do we want to raise information from the CDC or the World Health Organization or local state health agencies, but we want to be on the lookout for misinformation. And so a really important bit of the work that we do is seeing that we're getting in front of misinformation, and where we can, especially in services like YouTube, that we're helping to remove it where it's harmful, or creating content with influencers that they can bring that science right to the communities that really trust them already. So we consider it a major responsibility, and I think we've been doing great work across the world to address not only misinformation, but bringing forward quality information. We're going to keep leaning in to do that for this pandemic and beyond.
YouTube recently hired a doctor to strike some partnerships and try to get more of that quality information online, partnerships with with Mayo Clinic, with the Cleveland Clinic. Do you think the secret to this could be Google bringing in more health experts like yourself?
Well, we have been building up our in-house clinical expertise. We also know that it's a big world and it's a diverse world, and to have truly inclusive health information, that we're going to have to rely on partners, not just what we can build in-house. So we're really grateful to those who have been willing to partner with us through YouTube. We're going to do the same as we have in the past on search. I mean, we have, even before the pandemic, been working with groups like the National Health Service or the CDC or some of the mental health agencies in the US, so that when people ask questions about diabetes or depression, that they have a pathway they can navigate that brings them to authoritative resources. Google doesn't need to create a lot of this information. It's just that we need to help amplify the good information that's being created by these public health and other groups. So you're seeing us on the beginning of a journey, very accelerated by a pandemic, of wanting to be to meet people where they are, to be a great partner to public health and to medicine. And we look forward to continuing that after we can end this pandemic.